morning. We're going to be starting shortly, but if you can kind of some general instructions, if you would please mute yourself and turn off video, that will help with making the webinar go smoothly. And we'll get started here in just a few minutes. Thanks for joining us this morning. We're going to give it just another minute. We've got a lot of people joining us this morning, and we appreciate that. If you have joined us in the last few minutes, if you would please mute yourself and turn off your video, that will help with the presentation. But we'll wait another minute or two for people to get on, and then we'll get started.
Did you hear Sherry call in, Megan?
Oh, no, I was waiting for her.
All right.
Sorry.
Maybe her phone's on mute, perhaps. Sherry, if your phone is on mute, can you star 6?
Well, good morning, everyone. We're going to start our webinar. Welcome. If you're on the webinar, if you could please mute yourself and turn off your video, that would be very helpful.
With not knowing, let's go ahead and move
on. So we're going to go ahead and get started. Thank you for joining us this morning for this chamber webinar. This is our webinar number 8 in our series that we've been doing since COVID-19 has closed down a lot of businesses and caused us to have to do things in a different way. But We're finding that the webinars work very well, and we've had lots of great response, which we appreciate. And we've covered a lot of topics in the past few weeks, and we'll continue to offer webinars for as long as our businesses support them. So as we begin the webinar, again, I want to remind you to mute your microphone, turn off your video as you see on the screen, and enter questions into the chat box so that we can keep track of that and make sure we don't miss any information that perhaps is not covered in the comments from our presenters. So a couple weeks ago, we had an HR roundtable webinar, and the topic of childcare came up in that presentation. And as businesses reopen and bring people back to work, the issue of childcare is of great concern in our community and everywhere. Childcare has been an ongoing workforce issue for a while, and we've heard of instances where people have not been able to work due to the lack of childcare. And last year, a local group formed to look at what could be done to make childcare more readily available in Effingham County. Today, we welcome Shelley French, who's the director of the Effingham Child Development Center, Megan Ruers, who is the director of the Crisis Nursery of Effingham County, and Courtney Hatcher from Project Top Child. I want to introduce each one of them, and then Megan's going to talk first and tell you some information. So for the past 16 years, Shelley French has been serving as the center director of the Effingham Child Development Center, also known as ECDC. ECDC is a nonprofit licensed child care center that has been serving Effingham County and the surrounding areas, serving children from 6 weeks to 13 years since 1972. Megan Ruers is a licensed clinical social worker and has been the executive director for Crisis Nursery for the past 4 years. And Crisis Nursery's mission is to protect and prevent childhood trauma, abuse, and neglect through offering free 24/7 emergency shelter care for children birth through 6 years of age. Courtney Hatcher is the referral, recruitment, and retainment specialist at Project Child in Mount Vernon. She not only helps families find a child care program, but helps new programs open and existing programs remain open through various resources, such as training, funding, and technical assistance. Prior to working at Project Child, Courtney was a licensed family child care provider for 13 years in Clay County. So we have some very experienced people who want to talk to you about child care in Effingham County. Megan Ruers,
Okay, well, thank you so much for the introduction. And I do just want to take a quick moment and to thank everybody for joining us today as well. This is an amazing platform and a very large issue in our community. So I'm very thankful to be a part of this discussion and to have so many people at the table. So as Norma mentioned, our mission at Crisis Nursery is to support children and families and to help prevent and protect children in any way, shape, or form that we can, and to help keep families strong. So our services entail essentially anything that puts a child or family at risk could be a reason why somebody could use the Crisis Nursery. So you can think of from a medical emergency all the way to this very issue we're talking about today in accessing childcare. And usually the way that Crisis Nursery has impacted families up until before COVID hit, our role was really to bridge the gap for families that were trying to enter the workforce. And that could be providing care and support to families to attend job interviews, to fill out paperwork for a new job, to attend orientations at jobs, and sometimes to serve as a backup when their child care provider, could not care for their children for whatever reason. And so I just want to give you guys kind of an idea of how we serve and kind of fill the need for families. However, what we are seeing now amid the COVID-19 crisis, we are seeing families really struggling, as we'll hear today, really struggling to enter back into the workforce. They have job opportunities, but they're not able to access daycare because their daycares are either not opening, not going to open, or for other reasons as well, maybe medical reasons. And so in the past 9 days, I went back and looked at our statistics. We have had 9 families call for job-related care that was tied to COVID-19 in some way, and a total of 17 children in those 9 families that were needing access to child care. We were able to get, I think, 7 of them into one of the center-based programs that have an emergency license to operate right now, but that still left nearly 10 children that either their parents are not able to work, or those job opportunities were no longer available to them. And that is on top of, like I mentioned, job-related care is one facet that our program helps with. We had in the last 9 days 8 other major crisis situations that we were helping families through. So in the past year, roughly 16 to 20% of our admissions are related to job-related care in some way, shape, or form, whether that's supporting families entering the workforce or kind of serving as a backup for them if their regular daycare provider falls through. And most recently, just to share a story about one of the families to kind of give you maybe to paint a better picture of what what we might be seeing. I find so often that the reasons why people are calling the nursery is because of they don't have a support system like we may experience in our lives, or their support system has changed abruptly because of a death in the family or something like that. But we recently had a single mother reach out to us. She's recently going through the process of getting a divorce because during this pandemic, the children's father became abusive towards her and her children. So she has an emergency order of protection, and she's trying to enter back into the workforce. And as you can kind of imagine, she and her husband worked together before this to take care of their children, and now she does not have that support. So I know that before this all happened, we knew that children were at a very high risk of abuse and neglect because of, not having the supports of school and access to safe and reliable daycare. And we saw that firsthand here with one of the families that reached out to us. And so, just to kind of make a point of how important these systems are for children and families and their safety, but to allow our families in our community to be able to be successful and productive, to make and support their family and in our community. Childcare is a pillar, and allows our families to be able to do those things. And without that, families are really struggling. And so just to kind of summarize, our top 3 reasons for care almost always include job-related in some way, shape, or form. And we're seeing a huge uptick right now because we're in that in-between of the reopening Illinois of families that are needing to return to work but don't have access to reliable and safe daycare. And so Crisis Nursery is trying to bridge that gap in any way that we can. And we realize we're one piece of the puzzle and one level of care, so we're doing our absolute best, but we're really hoping that through maybe today's discussion, we can come up with other ideas of ways we can support the community. So that's what's going on at Crisis Nursery right now.
Thanks, Megan, for kind of setting the stage. Now we're going to hear from Shelley French from the Effingham Child Development Center.
Good morning, everyone. I'm going to primarily talk about what Effingham Child Development Center is experiencing, and some of that will be as a child care center, as an employer, and working with families. So a couple different aspects. Prior to COVID-19, ECDC served 155 children. Our license capacity is 111, but we were able to take part-time families. And For a lot of people, that's all the childcare they needed, and it was a great support. During COVID-19, our license capacity was cut to 50 children, and we were to only serve prioritized essential workers. The 50 spots quickly filled, and DCFS did increase us to 70, a capacity of 70 children. At the end of May, we were at our 70 children, and phase 3 came into effect. For phase 3, with all the new regulations and rules, our capacity is now cut once again to 65 children. That's down, we're down now 58% of our prior licensing cap. And people may wonder how are these decisions made? The first reason was 22 of our slots were for school age, 22 of our slots were pulled because they require a 6-foot distance between cots and cribs for children that are sleeping. Mind you, the same children play with each other, hold hands, and read and interact with each other all day long. But during sleeping, they're now required to be 6 foot apart. In school age, we had 24 school age slots that have been taken away from us because there isn't a hallway and my staff walk through the classroom. The same staff that are able to work with the children aren't allowed to walk through the classroom now. So 24 school age, which really we usually have about 40 enrolled because we have part-time, have now lost a spot at our center. The other big cut is that we must have stable groups of children, the same children. So for example, the school age, anybody that is part-time, maybe came days off school or snow days, we're not supposed to take those children because we're supposed to only have the same children every day of the week. So if they only wanted to come part-time, they should only come certain days of the week and they'd be set in stone. And on the other side of the table, we've had a big increase in expense. Our teachers who used to work part-time and full-time now must work from open to close. They want the same teacher with the same children all day long and no mixing of classes or ages. So teachers that maybe worked 8 and 9 hour shifts prior, all of a sudden got switched to 12-hour shifts. We've reduced our hours of service a little bit so that teachers can work the 10-hour shifts with a break and not suffer from as much burnout. Additionally, that means that 7 of my employees that were part-time, maybe they worked full-time for another childcare business such as Head Start or maybe a completely different field, but they worked part-time for me before school or after school. They are not able to work with us because they must stay the whole shift with the same children. So we have 7 employees that aren't able to work right now, but we are still paying them. And that is a requirement to continue to receive our DHS funding. As far as our PPE expense, prior to this, of course, we wore gloves and sanitation was a big concern, as well as keeping everybody healthy. We've now had to add in masks and goggles for staff or face shields. And all children over 2 are to wear masks when practical. Now, they can take them off for meals and for nap time. We're using gloves quite a bit more. Before it was for diapering and food. Now it's really for any type of personal care. So if your child is slobbering because they're teething and they need their face wiped, we're gloving up and a lot more hand washing. We have to have a smock. If I want to enter any of my classrooms, I cannot freely go in and out. I must put on the mask, the goggles, the smock to enter the classroom. So as the child care director, I feel like I've kind of been removed from some of my daily interactions with the kids and the staff. Another big change is our shoe sanitation. Initially, we were mandated that everybody had to have a separate pair of shoes exclusively for the child care center. We are able to sanitize them now in case a child doesn't have shoes. But we do have a pair of shoes for every child that we keep at the daycare and a pair of shoes for every staff member that we keep at the daycare solely for that purpose. Another expense that we had was setting up an isolation room. So if we have a child with a temperature of 100.4, they need to be removed from the classroom and taken into the isolation room. Another big expense is a health monitor. Up to this point, I had served as the director and the health monitor. Health monitor must take the temperature of every staff member coming on duty, every child coming into the center, and every parent. And all temperatures must be recorded. They also need to make sure that the COVID-19 screenings are done and ask if everyone's feeling healthy, and make sure that all the proper PPE is available. So if a child comes in without a mask, we have to make sure we go and get a mask. We do have an extra several baggies of masks thanks to our community that people can have donated, and we can get on the children so we don't have to turn anyone away. Parents are also required to wear masks to enter the building. And parents are no longer allowed to walk freely around the building. They can only come into the front foyer. So the health monitor has to monitor all of that. Cleaning and sanitizing expense has increased. Prior to COVID-19, hand sanitizer was not to be used in daycare centers because if a child drank it, it would make them very sick. Now hand sanitizer is mandatory. We have to have it inside and outside of every classroom. We have it on the outside of the front entrance. The parents must use it before they use the keypad to enter the building, and various stations around the building. We have to use it before and after managing the shoes, taking on and off masks, helping the kids, etc. Bleach is now used a lot more frequently. When the reopening first came about for phase 3, we were told we had to wash toys every hour and to use bleach. That has been relaxed a little bit. We are now washing the toys 3 times a day. Prior to COVID-19, cleaning was very important. However, we always put the children first. We never had a problem with sanitation, no history of write-ups or issues, but now sanitation is taken a priority over the children. At least that's the feeling that I get. With the reopening, we also had to remove a great deal of toys and equipment from our classrooms. Prior to COVID-19, these were mandatory items that DCFS required us to have, such as dress-up clothes, stuffed animals, pillows, baby blankets, seating like bean bags, area rugs. That's all been taken away because after one child uses it, it has to be sanitized, and it's impossible to run your bean bags through the washer and dryer between children. With the 6-foot spacing of cribs and cots, I pulled out 13 cribs now from my classroom. So 13 cribs that I originally had to purchase for over $200 each are now sitting with all the toys that we can't use stuffed inside of them. The 6-foot spacing between cribs and cots to me does seem a bit unnecessary, especially when the kids are interacting all day long. One requirement that we could do to get rid of that 6-foot would be to go out and buy commercial clear screens. These are averaging $130 to $180 each. So for a classroom of 8, I estimated I was going to need to purchase 6 screens. Now, prior to that, we did keep the children separated because nap time does go more smoothly if you're not playing with your friend right next to you. And we had our toy shelves or maybe our kitchen set. Things were in between the kids. They were never sleeping right on top of each other. But those items, bookshelves and whatnot, no longer count as dividers. We have to purchase clear screens. I'm not sure where we would be able to store those screens, and I'm not sure why they would work any better than a shelf that's at least a foot deep and solid. The only time that the children aren't required to wear masks are meals and outdoors. So if that's true, then when we're outside and we're playing and we're touching and holding hands, I would think that that it would be less than 6 foot. And why is 6 foot okay then and not at other times? In my opinion, childcare is already highly trained and highly focused on sanitation. So to put us now on such a focus of sanitation really takes away from the quality of care and education and time that we can spend with the children. We do have 2 staff members in each room at all times right now, and that does help ease the load, but you can imagine the stress level has gone up. In our area, we already had a child care shortage, and my center alone has a wait list with over 200 people on it. I can't imagine what the other centers, what kind of phone calls they're getting of people that are in need and in crisis. Our personal families that we've had to put on hold while they can't attend the daycare, I'm the one that gets to be the bearer of bad news. And it's a lot of stress, a lot of pressure. We want to serve our families. Excuse me. Often I hear parents are scrambling to find childcare. Some are even putting kids in risky environments. Children that aren't attending the daycare are left vulnerable and not seen by childcare staff. I think that we need to reform the governor's plan in a way that's friendly for the families and the children and the community. And I have also be happy to provide a list here with Norma of the contact information for the governor's office, the Department of Children and Family Services, the Department of Public Health, and the Department of Human Services, in ways that they can reach out and get a hold of the powers that be, so that we can get this economy back going by starting with the children and get them in proper care so the parents can get back to work.
Thanks, Shelley. As you can tell, this is an issue that's very dear and difficult for all the child care providers in Effingham County, because Effingham Child Development Center is one example of what's happening all over the county. I want to hear from Courtney Hatcher with Project Child. And Courtney, if you would take a few minutes to tell, what is Project Child and how does this all relate? That would be important. And Courtney has some statistics that I think are going to be very interesting to you. And just a reminder, please post questions that you have in the chat box so that we want to hear your thoughts, your ideas. If you have a question about this issue as an employer, we would really like to hear your comments, your questions in the chat box. So at this time, I'll turn it over to Courtney.
Hi, can everybody hear me?
Yes, you're fine.
Okay. Good morning. Thank you for inviting me to this meeting. I really appreciate it. A little bit of information about Project Child. So we are the Child Care Resource and Referral Agency for Effingham County. There are resource and referral agencies throughout the entire state of Illinois, and we are the one that does serve for Effingham County. We do lots of services that are available in our office. One of the things that we're most known for is the Child Care Assistance Program, which is the program through DHS that helps parents afford childcare based on income guidelines. There's also many other things that our office does, which is part of the things that I do. I am the retainment specialist, so I help programs that are already licensed. I help them with trainings that are required through DCFS. I help them with technical assistance if they have issues in their programs or they need help with something. We're always available to find resources and be someone that they can come to in need of being able to continue in their childcare business. I also play a big part in recruitment. So if there is an individual that is looking to open a childcare program in their home or looking to open a center, I have information that I can give out to them to help them, make that decision or kind of guide them along in the path. Also, that gives me an opportunity to continue to support them through that journey, so that they have just that extra resource and that piece to help, for them to obtain what they're trying to get to. Another piece that I do is the referrals. So when families are looking for childcare because they've moved into the area or their providers no longer are providing care or whatever their situation may be, they can call our office and I can give them a list of referrals for that area that they're looking for. I play a big part in that with families and helping them find childcare and giving them information about, what to look for in a program, what questions to ask, things like that. I kind of give them that parent piece of it so that I can help make sure that they get the right program for their family. And previously before the COVID-19, we had a lot of discussions about Effingham County in particular. And one of the parts of my job is kind of to bring some kind of a downer, I guess. I'm sorry, I just saw a question pop up, but I did not see it. Can Courtney have any influence on the regulations that come from the government? No, I cannot. Those all come from DCFS, which is the Department of Children and Family Services. So my influence would be contacting, representatives and things like that, as just kind of the same thing that you guys do. But I don't have any influence on that, unfortunately, because if I did, it sure would be different. I agree with a lot of what Shelley says. But anyway, when I look at Effingham County and I look at some statistics, which these statistics I believe were from 2017, before the COVID-19, there were already approximately 1,000 slots of children that were ages birth to 5 that were not in childcare or did not have a spot for childcare. That's not including any children that are school age. And, so not only did you have potentially 1,000 children that are birth to age 5 that were not able to get childcare, but then you had who knows how many children that are school age that are, being left with, unsafe places or being left alone or, who knows what the case may have been. And then because of the new DCFS regulations that were set out on May 29th, kind of, what Shelley was talking about the restrictions, the centers alone in Effingham have lost approximately 50 to 70 slots for children, depending on the size of the program. And I don't have any concrete statistics because all of this is so very new and programs are really trying to do the best that they can at this time to make sure that they are providing care for as many of their families as possible, but there's definitely a huge deficit in the numbers. And that also goes for the family child care providers. They have restrictions on their capacity as well. So some providers were licensed to be able to care for up to 16 children, and they've been scaled back to 10. So although 6 doesn't seem like a lot, if you have 10 family child care programs that are unable to care for 6 children, that that increases your number to 60. So in the grand scheme of things, that can be very big. Another thing that has also probably posed an impact is the fact that when the COVID-19 started, all the programs in family child care became license exempt. And so when they changed that, they were able to care for 6 children instead of possibly up to 16. That also meant that anybody could care for up to 6 children, and that was allowed. Normally, before the COVID-19, if you wanted to provide care as a license exempt provider in the state of Illinois, you could have up to 3 children, including your own. But whenever they suspended the license of the family child care providers and they raised the license exempt capacity to 6, that opened it up for anybody to be able to provide care. Now, since May 29th, they've reinstated the licenses. there could be many children who were going to that license exempt program or, getting that care that, had to also scale back to 3 because of the licenses being reinstated and then going back to the license exempt capacity being at a max of 3, including their own by Illinois guidelines. So overall, we're looking at a possibility of 500 or more slots for children being unavailable in addition to the 1,000 that already existed. And again, I'm not even including the school age children that are unfortunately not in the statistics that I have. And I'm not saying that this isn't happening everywhere, because there are many counties that there is definitely a shortage in childcare. But specifically for Effingham County, I think it was the first county that really became prominent in having a crisis situation. And I know that when I talk to those families that are moving into the area, because Effingham is growing, your area is growing, it is, it has many, many opportunities for huge growth. And when I have families that are calling in and they're saying, hey, I'm looking for childcare, and I'm giving them a list, and after I give them that list of programs, I always tell them, I just want you to know that it is extremely difficult to find a childcare program in this county. And I do that because I want them to know that they can call me back and I can help them as best as I can. But I also want them to know ahead so that they can share with other people and share with their employer that this might be an issue for them to find childcare. That is all that I have for this. And if anybody has any questions, I'd be happy to answer them.
Thanks, Courtney. There was a question about what facilities are open in Effingham County. Can any of you answer that?
As far as I know, all of the centers have reopened at the limited capacity in Effingham. There is over 30 family child care providers that are in Effingham, and I think that the majority, I don't know that all 30 something have reopened, but the majority of them have. But again, at a limited capacity for many of them.
Okay, thank you. Continue to put questions in the chat box as we continue the program today. I'm going to ask Megan to talk for a few minutes about the initiative that was started last year and kind of the status of that. One thing that I do know is that Effingham Child Development Center has plans to open a second site in Effingham. Part of that has been delayed because of DCEFS not being able to come in and do the licensing that's needed. So it's a multiplying problem that has a lot of different facets. But Megan, if you could talk about what's been discussed and maybe how people who would be interested could get involved.
Absolutely. So last year, since opening Crisis Nursery, I mentioned before, we've seen a huge need for job-related support for families in our area. It's usually in, our top 3 admissions for the year, for reasons ranging, like I mentioned before, from people that are simply trying to attend job interviews, all the way to providing support to families as a backup daycare provider and connecting them with programs. So last year, after lots of discussions with Shelley about the same thing that she was seeing, and the tremendous waiting list that she was having at her center, we decided to branch out and try to make this a community discussion and see how we might be able to address and make childcare more accessible in our community. And so we invited people that we were connected with that we thought might be interested, and then invited them to invite people that they thought would be able to help or be interested in just continuing the conversation on childcare in Effingham County and how we can support and, make that more accessible for children and families. And so we started meeting. We started trying to meet every week, but it was more like every other week, and just started brainstorming ideas on how could we get creative and think outside of the box in our community to, like I mentioned, support daycares, but also our goal was to create 200 licensed slots in Effingham. That's where we wanted to start. Again, this was pre-COVID. So now even just hearing from Shelley and thinking about all of the other centers in Effingham and home-based programs, we know that need is even greater now. But one thing that we are much closer to today than we were when we started in meeting with that group is working with HSHS St. Anthony's. They have a site at one of their buildings called the Pines that we are working with them to work towards getting licensed as, and I can let Shelley talk about this too, but getting that licensed as a satellite program for the Effingham Child Development Center. And so I don't think at this point we would have an idea of how many slots that would create. But that's a huge deal, especially now when we're seeing the cuts and the lowered capacities that our centers and our in-home providers are being challenged with. So, but that group, that's only one thing that group is working on. We're in discussions at really all levels to address this issue, from advocating at our, with our community government to create supports for child care centers in our state government, and we're also looking for just any other creative facets that we can, make action plans for to support our local center-based and in-home programs. I'm not able to see the question box, but I'm happy to answer any questions. And as far as getting connected, if you're interested in being part of this group, it's very informal, and we invite anybody and everybody that would like to be a part of this. Definitely power in numbers to be able to put things into action. The best way to do that is to simply get in touch with me, and I'm the keeper of the email list for our meeting, and I would be happy to add you to our email list to stay connected. That's how we send out meeting invites, information, all that good stuff to keep everybody in the know and connected. So I'll be happy to share my contact information with Norma to give out to everybody, or whatever is easiest in that regard.
Okay, if you do want to receive emails about that, if you want to put your email into the chat box, we'll give that to Megan so she can get you involved in this initiative. I want to turn it back over to Shelley for a few minutes, and then we'll address a few questions that have popped up in the chat, and how can we, as employers, what can we do? How can we help? I mean, that's kind of the purpose of today, is creating that awareness of the situation that exists, and it is a workforce issue in Effingham County that needs to be addressed. So I'm going to give it to Shelley, and then we'll look at some questions.
Okay, so let's look at some of the sunshine and ways that we can make a difference. In the daycare centers and the in-home daycares, we need some commercially made dividers to go between cots and cribs, and that will increase our capacity. So in my infant room, for example, with the 6 foot, I can only have 8. If I have dividers, I can have 11. The 2-year-old room, I can only have 8 because of the 6 foot spacing, but if we get some dividers, I can go up to 10. So every little bit helps, and every child care center and in-home center are going to be in need of those. How can we get them created? They must be commercially made. So is there a business in town here that can fabricate those? The other thing is, if we need more daycare in Effingham, which I know that we do, I've been approached by many business leaders and HR directors. We need to come together, and it's going to have to be a community effort. So let's put our heads together, and we've got a potential location, but there's going to be a lot of expense in renovating and getting all the supplies that's going to be needed in there. So if you really want to make a difference, help join the team, and let's get our heads together and figure out how we can make it happen and how many more slots we can create for our county. If you need a list of more ideas, I'd be happy to share with you.
Courtney, do you have any comments you want to make? And then there's a couple of questions we're going to get to.
I just want to say that, there are so many great ideas that are happening with this initiative in your county that Megan and Shelley have been working so very hard. And they are really making some amazing progress, and I'm just very grateful to be a part of it.
Okay, thanks. There's a question that says, in the short term, what specific changes would you recommend to DCFS and/or IDPH and the governor that would help economically and keep children and staff safe? So any of you want to tackle that question? What specific changes would you recommend?
I'm happy to make a couple points. One, on the staffing, I have some amazing part-time staff that maybe work for Head Start or school districts. Allow us to have part-time staff come in and help work in the evenings or in the mornings before and after school. Also, the 6-foot spacing is not realistic. Let's change that rule. That there's got to be some other ways to fix it. I'm happy to provide information on how to get a hold of those people that can make those changes. We have a list of other ideas that I've gotten in working with the Illinois directors of daycare centers that would be like all across the board that could help address problems, whether it be in a small rural town up to a big city. So I can provide that list.
Megan or Courtney, do you have any suggestions for the governor and the DCFS and IDPH about what could be done to get more daycare slots open?
I mean, they really just, I think, need to go back to the way that it was. And, like Shelley has said, they're taking away, that education and that, interaction piece that's so important for development. And, they're going outside and they're interacting without masks. And there's really no difference between that and being inside. One of the requirements to even be a licensed program is that you have, sanitation is important. And they really need to, go back to the way that it was so that the children are getting that developmental care that they need. And that the sanitation, I don't feel was a problem from the beginning, with the DCFS regulations. So that would definitely be something that, in order to raise capacity would be valuable.
Yeah.
Megan, any thoughts?
Yeah, I'll just echo. I agree with everything that Shelley and Courtney have said. I think that working in the childcare industry, sanitation and cleanliness and hand hygiene has always been priority. And I think that sometimes we see, especially sort of at the state and the federal level, a lot of when pandemic or crisis situations happen, there's knee-jerk reactions and then lots of regulation changes without sort of taking a realistic approach. And I think there's a lot of people making decisions that aren't necessarily connected with childcares or connected closely, I should say. So I think the regulations are coming out of a place of definitely wanting to keep everyone safe, but it's crippling our system. And I think I'm most concerned with the social emotional impacts that it's going to have on our children moving forward, because out of everything that Shelley shared of her changes and just everything that they're having to go through, I think that one of the things as a parent with two children in daycare and in school, one of the things that's so important to me are the relationships and the care that is provided to my children and the closeness that is provided when I can't be there. And, I feel like that is getting in the way of that so much. And, like I mentioned before, kids are not safe right now. They're at high risk because they're not seeing daycare providers and they're not going to school. And sometimes when they're going to daycare, the only love and attention they're getting is through their daycare providers. And I think that's going to be an impact that sadly we'll probably see moving forward. But not to get off point, that is, I definitely agree with everything that they say. I'm excited. I don't know much about it, but I did see that there is a grant that the governor has put forward for I believe it's licensed in-home and center-based daycares to help offset some of the costs that Shelley mentioned and that the centers and the in-home providers are facing. So I hope that that's helpful as well, because at the end of the day, you have to have money to be able to operate. And, that's, as Shelley mentioned, there's huge financial obligations being put on an already very stressed, system. So that's my 2 cents anyway.
Well, thank you so much, Shelley and Megan and Courtney. What a great discussion. I hope that people on the call or on the webinar and people who listen later really have learned something. You issue that's very important. It affects our workforce, affects, when we talk about growing our community and new people coming in and wanting to move to this area and finding out that they're not going to be able to get the daycare that they need. It is a problem that we need to all work together to resolve. Shelley gave some resources. We will make sure those are made available. We'll post Shelley and Megan and Courtney's emails so everybody has their information, and we can look forward. This webinar has been recorded. It will be available tomorrow in the Chamber's Business Advocate and on our YouTube channel going forward. And you will be receiving an evaluation form about today's webinar. We ask that you complete that and send it back to us so we can see, hear your thoughts on the webinar itself. The other thing I want to mention is that, as I mentioned early on, that we want to do these webinars for as long as people want to hear them or want to be involved in them. If you have topic ideas or speakers to cover those topics that are relevant to what businesses need, we certainly love to hear those from you. So post them on the chat box. You can email me you can find me on the Chamber website. And then next week, our webinar on Thursday, June 18th at 9 a.m. We have Roy and Kay Dent, who are local attorneys, and they're going to be presenting a webinar on keeping your business on track during COVID restrictions. And they'll be discussing things like business structure, business operations, financial considerations, and also just that personal aspect of your business. We're all very personally involved in our businesses and what we do, and so they're going to be providing some really good guidance on that. So thank you for joining us today. Again, we had a great number of people on the call. Thanks to Shelley, Megan, and Courtney for just an excellent presentation, and wish you all a good day. Thank you.